Hello and welcome to Unit 402, Communication in Health and Social Care. We're looking at part 3 of the unit, which is really looking at ICT, that's Information Communication Technology in Health and Social Care. The objectives that you'll be working with are from 3.1. So it's really looking at the benefits and challenges of information communication technology, and the main focus is how ICT has benefited service users in health and social care and how ICT has benefited health and social care practitioners. So they're asking you to answer this question sort of slightly separately. So what I would suggest is that you do a paragraph on each, really, what are the benefits. Now, some of your examples may benefit both patients or service users and practitioners, and then you can say that as well. Okay. You may notice that the question doesn't really ask you to talk about the challenges. It just says in particular. But what I would say is that focus your answer mainly on the benefits, but it's worth putting in a couple of lines about, where some ICT can be a challenge or some of the problems or risks that could arise. But otherwise, the majority of your answer should be focused on benefits. Okay, so what is technology? Well, it's something that's all around us. It happens in all sorts of different forms of work. Um, just imagine your mobile phone 10 years ago was a lot of a simpler machine than it is now. Some people didn't have one 10, 20 years ago, and now, we can't really sort of go anywhere without them almost. And it certainly didn't sort of have all your favorite music on it, and it didn't have a fantastic camera that's so good that you don't even know where your normal camera has gone now, or if you even have one at all. So these sort of things we sort of think are sort of standard now, but 10 years ago they were serious luxury add-ons, really. um, and for most of us, that's a great thing, and we all get into grips with all the different technologies and the using of social media with our phones because they both sort of develop together. But for some people, especially sort of people of an older generation, they or people with sort of different disabilities, they may actually find that the complexity of a smartphone too confusing or too difficult to manage. Those things aren't always perfect. When we think of technology, it's not just about computers. That tends to be where our mind goes first because we've all got our laptops, our tablets, whatever. Um, but technology can also be other major developments. So, additional medical devices that can be developed to help people function better. I've got an example here that even just a handrail on the outside of a house for someone with disabilities is actually a very simple form of technology. It's been designed and created for a specific purpose. At the more complex end of the scale, there's people living at home now with telecare systems where they report people with diabetes, COPD, all those sorts of things, are heart disease. They're able to check their own blood pressure, check their own breathing capacity, and send messages forwards to the clinic to save someone having to actually drive out and come into the house just to do sort of something simple, or save the service user having to go to a doctor's appointment just to have their blood pressure taken and things like that. So there's been a huge development in that area. Even things such as biotechnologies, which is a much newer sort of form of technology, bandages that have special product in them that speed up the healing of wounds, bandages that can actually adjust to alter tension and pressure. They're quite interesting, and they're fairly new as well. So that If someone's got an inflamed leg, they can adjust to the right amount. Also, surgical procedures. There's a huge amount of technology involved in surgical procedures now, and most surgeons are supported by lots of robotic instruments that can help them do some of the fine stuff that's even too fine for a great surgeon to do. So lots of things to think about. So to put it simply, technology is a tool, enabler, that in healthcare we generally use to improve the health outcomes for all patients, and for us staff, it will save time and cost, or just make the outcomes better by doing it in a way that's maybe better than the average human can do it in that sense. And it also enables us to access information more quickly, so we can make better decisions and we don't have to go back and sort of change our minds again. So we're really going to be focusing in this area about ICT, which is information communications technology. So it's about that accessing of information. We're not really going to be talking about some of the hard technology that I've just sort of mentioned, because we don't really have time as part of a communications unit. It might come up in other discussions. So we're going to start really thinking about some of the different sorts of technology that are used in health and social care, focusing, as I said, particularly on ICT. So one of the things that we're doing now electronically, much more than ever, is capturing and storing and sharing information. So at the moment, some health communities are already sharing patients' records, certainly within the locality, from your local hospital to the GP, backwards and forwards. It's actually getting on a wider scale as part of the big information rollout, which I'll talk about a little bit more later. And now, if you go to a specialist hospital, say in London, your patient record can often travel with you there as well. They started first in localities, and then the idea is to link up across the whole country, really. And that's sort of happening in its own time. So some communities are a bit faster ahead than others. Also, lots of care homes are coming on board, and other community services like day centres that are coming on board by linking up with the same sort of care recording systems. And we'll find that most care homes, it's not just the NHS, but lots of care homes as well have their own electronic system. And with the use of email, a lot of things are going backwards and forwards. Another thing that's developed as well is digital technology for X-rays, other clinical images like MRI scans, CT scans, ultrasounds, all those sorts of things, which are taken basically as pictures, and they are now stored as pictures when they used to be, stored. If anyone's ever seen an old X-ray, like big plastic sheets, they used to have to keep them in files in a sort of library effect, really. But it means now that if they're online and they're shared images, then the GP and a consultant could bring in another consultant, and they can be having a discussion across the country about this image to say, they can discuss a treatment plan together. The other thing is the images are now instantaneous. So when you go for an X-ray, the moment the picture's been taken, it's just like you sending a JPEG picture on an email. It's instantaneous. So the moment the radiographer has taken your picture, it will go into your records and it'll be sent to the person who's asking for it. So nowadays, if you sort of walk out of the X-ray, you can go to your appointment 5 minutes later and they'll be able to call up your image. We're also making better use of our knowledge and making it more accessible. This is something called the Map of Medicine, and it's been created by health professionals for health professionals. and it gives them fast access to best practice guidelines. So here's a sort of image, right? You can see how they've created the procedures which enables them to sort of make decisions about diagnoses. And it's to help, new or maybe a doctor who hasn't been working in that area very long or is still researching. Somebody else might have found, developed something on the other side of the country. They can add it onto the map of medicine. And it's a bit like Wikipedia, really, that any of the users can go in and add things. And so it's sort of bringing local knowledge national, really, or if you might be a professor who's a specialist in here, it's COPD management. You might have come up with some ideas that other people don't know about, so you'll be adding it into there. And you can see they've got sort of broken it out into different areas, what you're going to do, and they've created sort of procedures, next steps. If you want to find out more about the map of medicine, you can just click on the website. There's tons and tons of them. As I said, it is like a health professional's Wikipedia, really, in that way. And you can click onto the various areas and think about what you're looking for. Another example is paramedics. So they have their specially adapted laptops. They're fairly chunky, a bit heftier than the ones that we're used to. These will come in a little case so that they don't get damaged, because they're sort of going into all sorts of different environments. They have touchscreen controls, and they can put all the information. So when they're doing someone's blood pressure, breathing, they might be doing a heart monitor. They'll put that on first. If they can find out the information of the person, and the person is, local under the local services, then there'll be a patient record. And they can either update straight to the patient record, or even if they can't, if it's a new patient, like a visitor to the town or something, then at least under that person's name, they will have started to create a record, so that when they when they get to the A&E, they can actually sort of pass it through, so people can sort of flick it up on the screen. It saves time for them, instead of them doing a long, complicated handover, really, because they can be doing it on their way. That's why they have to be robust, because they get flung around a bit in the sort of ambulance as well. Using everyday technology, just using your mobile phone with specific apps on it, which have been created. If someone with long-term conditions such as diabetes, heart disease, they can get texts from their local health team reminding them to come in for checkups. If someone's a bit elderly and they're a bit forgetful with their medication, you can have phone alerts just sort of saying time to take your meds. And if they have to sort of do their blood tests, or put in a result like a blood pressure or something like that, they can remind people of that as well. Because telecare was developed with a focus on old and disabled people, because it's harder for them to come in to maybe the GP surgery. They might not live that close, they might not drive, things like that. It meant that nurses were always having to come out to check some of these routine things. And the phone app, once created, the nurse will put in all the information at the screen. So she will put these sort of text reminders in. I get text reminders at the moment from my GP. If I've got a GP's appointment, they'll send me a reminder like a week before, and then they'll send me another reminder the day before, and then they send me one on the day. It's all automated, but it's like, don't forget to turn up. Other types of technology, we're using technology to help people with disabilities or impairments stay active. Now, we've talked about this before. One of the examples that I've given you here is, say, somebody suffering from head and neck cancer, so so they may well have lost the ability to speak, can now use electronic speech aids, and there's a sort of a picture of one there really where they have lots of pictures, but then they have different slides that move around. And the telecare that I was talking about earlier. So thinking about some of the things that can be done, and it's, you know, there's quite a lot of different areas. So what sort of impacts have changed? So operating theatres need to be well organised so that they don't sit empty for too long and the turnover works quite well. So they're now using electronic theatre systems and scheduling so people can book slots into them, and this enables them to be filled up, or you can see when they're available. So that sort of helps really. Improving patient flow across the NHS, and that's having the access to, say, like the X-rays, and that instead of waiting for those to turn up. I mean, that it used to take a couple of weeks. They'd have to go off. The picture would be developed, so you'd have to come back for another appointment. Very often, you can go to your ultrasound, and then 5 minutes later, you can go into, as I said earlier, you can go into your meeting with your consultant and the picture will be waiting there. Now, before you would have to say, you might have your appointment with a consultant, but you couldn't do a lot because he hadn't seen the pictures and the pictures wouldn't have got done in time. Generally, sort of managing patient discharges, which is really sort of making sure that you have set template letters to send out. Again, they're sent out electronically. So if you're preparing to discharge someone, people find out about it very quickly, which gives them time to start to prepare and to make other appointments for them. It's the same with patient admissions or clinics. Clinics are being well streamlined because they now have a choose and book system. So you might get a letter saying, you know, or the GP might say, right, I need you to make an appointment at the X-ray clinic or the blood clinic. So you'll be able to do that nowadays through the NHS app on a choose and book system. So you can go online and find out when the next available appointment is. And if that doesn't suit you, you'll make a different one. So whereas before they would create an appointment, send it out to you in a letter, you'd get the letter, say, I can't make that appointment because, you know, I've got another appointment on that day, or, you know, I have to be in another town with my work or something like that. So now you usually, you know, you can have the choice. So again, it's saving time, because before you would have to phone them up and say, I can't do this, can you make a change? And time and letters were wasted. And the same with follow-up patients. We've already talked about people being monitored in their own home, but using the telecare system where they can do quite a lot of it online, or they can send in results or feed in their blood pressure on a daily basis. So the nurses will see it. They will come in first thing in the morning and check those sorts of things. And if they have concerns, they will call you and make an appointment to come around and see you. If they don't have concerns, they won't. So in that sense, it actually streamlines the work they're doing. They're not going out to see everybody just because. They're only going out to see the people that they need to, which gives them more time to see more people. I mentioned the national IT program that's happening in the UK, and this is about really getting everybody on board. It's feeding out from the NHS. It is the biggest civil IT program in the world, and it affects everybody all across the NHS, GPs, surgeries, community nurses, various other related therapists. And hopefully in time all the care homes will be linked to it. That's the sort of main aim. And it's it's to have the same system of communication. Now this has always been difficult because the reason it's taken a long time, and it has taken many years, I can assure you, is because each NHS system have often bought their own care management software. So they don't all join up, of course. Somebody somewhere else might have the same one, but often the GP down the road from you may not have the same one as the hospital up the road from you. So that's what's taken so long to iron out. And it's about introducing new systems and trying to come up with a national system that everybody likes. If you can imagine, that's what took the most years, really. Then it expanded into connecting with social services as well, so that they can access the system too. That's the way it is at the moment. I think in time they would like it so the whole thing's integrated, so everybody's using the same software, so the national IT team can sort of manage it all. But it is taking years. So using ICT is really giving staff the tools they needed to sort of summarize what I've just been saying, to practice better medicine by having, their x-rays and their test results to hand immediately. And that's using what is known as the picture archiving and communication systems, that's commonly known as PACS. You'll hear it mentioned in hospitals quite often. Improving patient safety and clinical governance by having the electronic care record and the electronic prescription service, which connects from the prescribers, either the hospital or the GP, to the local pharmacist, and then back to your patient record. So everything is recorded immediately. Nothing is getting lost in moving from one place to another. Achieving better outcomes with the same resources, upgrading email systems so that staff, and encouraging and training staff to use email systems rather than just using telephone calls, which all have to be written down and recorded. Using the email system, having templates that come out of your patient records. So if you're a clinic, you might have a clinic template. So if you do want to send something to a GP, the consultant might only have to fill in the template and then just send it across, so it saves them a bit of time there. Enhancing the patient's experience. The choose and book system very much enhances the patient's experience. They're very frustrated. I've certainly experienced this myself. You get a letter and you know that you can't make it to that appointment because they don't ask you. And then you have to ring up and hang on and wait, and it might take you a couple of days to get through on a phone call, and then change your appointment, which could end up being weeks ahead. So the choose and book system, if you want to be seen urgently, then you will change other things in your diary and then book it in. So it just gives you a little bit of choice, and it can give you a choice about where to go as well, what clinic to use. So I'm showing you sort of 3 little case studies, just so you can think of some examples. When you're doing your assignment, you might want to, you don't have to use my examples, but create some of your own just to show me that you've understood some of the points. So getting the most from the PAC system, picture archiving and communications, it's improved speed. We have instant image access. The person can actually see it before they leave, or if it's an x-ray, they probably can't read it very well. And it can magnify, it's just like when you're looking at Google Maps, you can enlarge it, make it smaller, spin it round, highlight different parts. You can see different shapes and sizes. There's a measuring facility, so if you're looking at a lump, say in somebody's breast, you have a little measure thing that you can pull in and it will measure it pretty accurately. So really enhances the skill of the diagnosing. It makes clinics work better because no one's running around and carrying pictures here, there, to that clinic upstairs and that clinic over there. So that's, and there's no chance of them getting lost on the way because they're on the system. Patients are happy because they've had their x-rays, they go to the doctor's appointment, as I said, and when they're getting to see him, there he is, he's got it up on the screen and they can talk about it together. So he can explain what they're seeing. So valuable in lots of different ways. Getting the most out of prescribing. They've been working for years towards paperless practice, and they've sort of pretty much got there now. So what used to happen before was that, a GP would see lots of people, and in between, or often at the end, they would write up all their medicines. So if they wanted to prescribe somebody something, they'd sort of jot it down. And one of the issues about this was the prescriptions were often quite scribbled, and sometimes pharmacy couldn't understand it because they're working very fast, the GPs. So some of them would do it at the end, so they'd have to make themselves a list of all these medicines. So you can see it was a bit of a job. They originally started printing them out, and then they had to sign them. So it got better. They could actually do it digitally, but they would have to do a physical, real signature. So they'd all be kept to the end of the GP surgery, and then they'd sit down for half an hour signing all these things. Then the practice manager would take them away, and they would get physically sent off in a bag to the pharmacist, or people would come and collect them, and then they would take them off to their pharmacy of choice if it's a community GP. Now that's fairly time consuming for everybody. Doctors now have digital signatures which are set up at the beginning when they start to use the system. So they will just click and drop. They've digital signatures onto the prescriptions, and the prescriptions will electronically will go, if people have a name pharmacy, if people have chosen to have a name pharmacy, they can be sent electronically to the pharmacy, and they are. So then normally, say like the system where I am, if I've been to the GP and they want to change some medication I'm on, they'll do that there, and then that will shoot straight off to the pharmacy. And when the pharmacy's filled up the prescription, they'll just send me a text and I'll walk down to the pharmacy. So I don't have to go to the GP. I don't have to pick up a prescription. I don't have to carry it to the pharmacy, and I don't have to wait for them to fill it when they're busy. So in that sense, it's been a really good thing. People at the pharmacy don't have to. Also, before, when they got the paper prescription, they used to have to manually input it onto the pharmacy system, so it tallies up with the drug records and things like that. And that should improve accuracy, because they have to do it really super carefully, as you can imagine. 20 milligrams Valium or 2 milligrams Valium, and if they get interrupted when they're typing this in, they could give you 20 milligrams instead of the usual dose for Valium, which is 2 milligrams. You send someone away with that, you'll kill them in a couple of days. So it's actually quite valuable, really. The new system has reduced mistakes that happen there in the pharmacy area, but it's also saved lots and lots of time for the patient who is waiting for their medication, because they get a text saying come and get it, and it's all sitting in a bag waiting for them. So no time standing around wasted. Smarter care for clinical systems is really the way they manage clinics now. And as I said, they're starting to use lots of templates for clinics, and they'll have codes for different conditions. So it can speed up the amount of time that people are using. When they've seen someone in clinic, they have to sort of add to the record fairly quickly. But using these created templates, they can put them in quite fast, really. So the turnover of the clinics speeds up, and people aren't kept waiting around for too long. More examples of benefits. I'm just going to pick a couple out there here for you to read, really. I've mentioned computerized telephone monitoring for people, say, with chronic lung disease. What's the benefit of that? Well, people can get the advice much more quickly. So nurses can see your results. If there's not a problem, then they don't have to phone you. If there is a problem, they might phone you for advice and they might ask you to come into the surgery. So they can intervene very quickly. Oh, I'm not happy. Mr. Brown's lung function has been down for 3 days. We better get him in and see, or we might need to prescribe him something over the phone. So in that sense, so by intervening quickly, they can also a good measure of this is that they reduce unplanned hospital admissions, and that would be positive feedback because they're actually dealing with it quickly. Nurses are also using PDAs, personal digital assistants, which are small tablets. So when before, any of you who's been in hospital, you used to have a chart on the end of your bed with your BP and your general observations. Now it's all being done onto a PDA, which is, as I said, a little tablet. You just go up, put the patient's record in. So they can do things as they're moving around. I've just taken someone's temperature, I put it straight in. I've just taken this. So, there used to be an issue that maybe someone had taken the chart from the end of the bed because they were changing something over in the office, and you've just taken the temperature. And now you've got to walk around and find it and remember someone's temperature and remember which patient it was. Or you get distracted by some emergency that's happening at somebody else's bed and you forget to record it. So when you're doing it with the PDA, it's they have it in their pockets, or they carry it around with them, and they can just literally do it. And then once they've done that, they walk away, they leave the patient, and they go on to another one. It also means that once you've entered it into your PDA, it's on the main records as well, or people can pick it up on their own PDAs. So they can come up and go, oh, what was Mr. The doctor might say when he's doing his rounds, can somebody tell me what Mr. Brown's blood pressure was this morning? And the nurse that has taken it might be somewhere else dealing with somebody else. But another nurse is around and say, hang on a minute, and they can just look it up on the PDA. Or the doctor will have one of their own and they can look it up for themselves. So the communication has massively improved. Recording accuracy tends to go up. And the time for information to be shared is completely reduced because no one's waiting for you to go back later on the day when it's a bit quiet to fill in all these charts. So really, I've concluded what the benefits are, and I've done a conclusion about some of the risks as well, because I think it's just worth you addressing them. Okay, I'm not going to go through each benefit. I'm just going to pick a few out that are particularly focusing on ICT. So, giving the service user more control over their own health, safety, and well-being. Helping communication with families, professionals and staff. So, communication can go out wider out of the hospital or out of the care home. Capturing and comparing data, as well as sharing good practice with your peers immediately. Offering the potential to have more immediate access to a consultation remotely. So it's not always relying on someone to come into the doctor's, make an appointment and have a consultation. As well as some of the text information. The community nurses can also have video calls with somebody, WhatsApp communication with them, checking things out as well. So there's lots of stuff like that. Providing easier to read records, as you don't have to decipher handwriting. That's always been a terrible thing. And this is something that's reducing a huge amount now, which is obviously very good for the service user because less mistakes are made. Making that patient information more easily accessible between different locations because it's all online. It doesn't really matter where you are. You can access it as long as you've got your password. Meaning digital information is less likely to be lost, damaged, or destroyed, as paper records can be. They can be forgotten or left in the wrong place, or get thrown away by accident, or someone spills their coffee over them and they become illegible. So overall, it can enhance the care and treatment providers can offer. So you've got benefits there for the staff directly and benefits for the service user, and some of them are benefits for both, obviously. So a quick thought about some of the risks, because there are. An over-reliance on technology might reduce practical clinical skills. If those nurses don't have to go around, checking people's lung functions because they've taught them to do it themselves, they may lose the skills to do it when they do have to do it. There's always that risk of cyber attacks and data theft, unfortunately. Some crazy people like to hack into all sorts of things. And, when all your information is electronic, although the NHS prides itself on the security of its software, there's always someone somewhere who can probably hack it. That's just sort of the way of the world, really. It could be inequality in different areas because some areas might not be able to afford all that technology. The NHS will have huge amounts of money being given to it to upgrade the technology, but when someone's in a care home, it's quite an expensive thing if it's a small private care home to pay in for the software that happens there. So it might take them a long time. They may never do it, really. Unfortunately, one of the negative sides, which I think is really important about telecare, is that loss of that one-to-one time. When the community nurse was dropping in to see people, maybe to do their lung function, maybe to do their blood tests or their blood pressure, they were also talking to them about other things. For some elderly or disabled people, it might be one of the only visits they get in a week, so that interaction and that sort of support and knowledge of someone listening to them and knowing that someone's there drops away a bit with telecare, and it can have its own negative effects on people's well-being, their emotional mood, and that which really can't be ignored. So they do need to come and do some visits sometime or create some other system. Inputted errors, rubbish in gives rubbish out. So if you've put in the wrong prescription, they'll get the wrong prescription, so you've still got to be careful and look at what you're doing. If there's a technical fault and your systems are inaccessible, well, that's everything gone to pot, really, because you don't have a written backup. So if you have a power outage in your GP surgery and you can't see any of the records, that's really, really difficult. Some of the things that might see that could aid in a diagnosis or things getting more complex, if you have a video consultation instead of coming in to the surgery, there might be other things about your demeanor, about your body language, and that a doctor might pick up on, which could aid their diagnosis. Other issues, because it's just the way they speak to you and they find out, and because people go with one pain and then there might actually be something else wrong as well. And I think it's a lot easier when you're, we've talked a lot about verbal and non-verbal body language and how much you can pick up from that. Obviously, when you're doing video conferencing, you can't always pick it up. Okay, the other one's about robotic aids, so I won't go into that. And the final one is additional time and costs in training to use new technologies. But we're talking about all this software, all these systems, but they all have to be learned how to be used. The community nurses need to feel confident using these electronic systems. Remember, they're learning, they could have 100 electronic systems being given to them at once. Screen imaging, maybe that one's quite easy because it comes through email. but setting up care records, they've got to learn all the processes. Clinics, they've got to learn all the templates and what needs to go in them. The telecare monitoring, they've got to learn how to do it and what the different alerts mean. So, you know, there's always learning and everybody needs training. If they don't have it, they won't do it well. Okay. Yeah, I've just added some more useful links. You might want to highlight some of these areas and have a look at them. Okay, you can't click through from your video, but you can write them down and put them in your browser. Okay, so there might be some other ones to help you expand your answers. And here's some references for you. Okay, thank you. Well, that's the end of part 3 of the level 4 communication unit. Thanks.